Good afternoon, everybody. We're about 2 minutes away from getting started, but this is the California Association of Health Facilities, Los Angeles County Emergency Preparedness Updates, webinar 16 in our series of webinars. Obviously, this one's going to be almost exclusively COVID and emerging infectious disease information and updates. We've got some really important stuff we want to pass across. We want to dispel any discrepancies with information you're getting from multiple agencies. So give us about 2 more minutes for folks to get on, and then we'll get started.
Good afternoon, everyone. We're going to go ahead and get started here. So again, my name is Courtney Kesterson. We are the CAF Disaster Preparedness Program. I'm the coordinator. Jason Belden is the Director of Emergency Preparedness and Physical Plant. I believe our program liaison, Rich Woderinsky, may be joining us in just a couple minutes here. So we're going to go ahead and get started just to respect everyone's time. I can get the party started here. There we go. All right, so there are our names. If you've joined us before, you should know by now. So our objectives for today, we're going to review recent guidance from the CDC, ACA NCAL, and then some guidance just came out from LA County today that we kind of managed to squeeze in here. So this should be, as of now, the most up-to-date information. Under your handouts, we have the evaluation for today. We have an agenda with some links. So we're going to refer to some links here. You can click them in today's agenda under the handouts. The slides from today are available in the handouts, and then the 2 guidance documents that we will be kind of reviewing are available to you there as well. So definitely check those out and use them to follow along if you wish. So we have some new acronyms that we maybe haven't seen before. So we've got EID on here, Emergent Infectious Disease. We've got the CDC, Centers for Disease Control and Prevention. I almost said dessert. Dessert control. And I think that's it for new ones. So we have quite a few slides here, so we're just going to keep moving pretty quickly. Again, if this is your first time joining our County Emergency Updates webinar series, we have this webinar series and this grant specifically for LA County just because about 1/3 of long-term care facilities are in LA County alone. But that also means that you have a lot of partners to work with, so including the disaster resource centers. If you are familiar with the disaster resource centers, that's great. We're going to talk a little bit about them today, but again, going to push forward so we can get to the COVID stuff. If you have not heard of the disaster resource center system or contacted your local DRC coordinator, please email me after today and I'll get you their contact information. During the spring, they have their hazard vulnerability assessment meetings, which are really important for long-term care providers to go to. If you don't go to any other meetings all year, this is the one you want to go to. So Again, you can visit our webpage for LA County. That's going to be cafdisasterprep.com/LA County. And we have the meeting dates listed there. And again, contact me if you don't have the coordinator's information. So normally we have Rich Witerinsky give us a rundown since he attends all of the DRC meetings for us. He's not on yet, and we really want to push through to the COVID stuff, so we're going to kind of just do a quick overview of these here.
And we will say about these HVA meetings, please confirm at the email address listed there for each DRC, just to see if they're going to have the meetings. Really, many industries, not just ours, have cut back, in-person meetings to do virtual meetings. So confirm with the DRC coordinator before you just show up for the meeting.
Yeah, and it looks like we might have Rich on the line with us now. Rich, I'm going to try and connect you here. It doesn't look like we have audio from you, so if you want to troubleshoot that and then maybe try again. But here, so we're just going to take a quick look at kind of where we're at with the HVA meetings. So again, you can visit our LA County webpage if you want to see when your local DRC meeting is happening. And like Jason said, they may have moved it to a conference call, so that's kind of an extra layer of logistics going on there. They're going to bring together all the different sectors, review their hazard vulnerability assessments for 2020. So if you haven't completed an HVA before, we have some videos from past webinars on our YouTube channel. So if you go to youtube.com/CAFTV, again, that link is available in today's agenda, an actual hot link that will take you right there. So let's see, I believe that there was actually an HVA meeting today that was canceled or moved to a conference call. So let's go ahead and take a look here.
Yeah, I think that was Long Beach Memorial was today, but I'm not sure.
There we go. So these checks obviously just mean that they've already taken place. If you are unable to attend the HVA meetings, you'll still want to email your disaster resource center coordinator and get a copy of that HVA because you'll need it for your own records to satisfy, I think, ETAG 6 when it's survey time. So just from like a documentation point of view, if you're unable to go to the meeting, still try and get a copy of that HVA and update your own HVA for 2020 as well. Emergent infectious disease will probably bump up to the top of your hazards, I would imagine.
And if it's not, let me tell you guys, this is serious stuff. This needs to be number one on your HVA for this year.
Right, and so again, if you need to look at these dates, you can see them on our website. We have a separate page for LA County, and again, the hot link on there is on the agenda. So, and then we are going to talk a lot today about using ReadyNet for resource requests and stuff like that. So just an update that they do have ongoing training now. If you find yourself wanting to train additional staff, the links to sign up for this webinar are again on the agenda under handouts. So with that, we will go into our section for updates on the COVID-19 stuff. And we're going to start with some slides that were taken from the ACA NCAL webinars. So just in the interest of making sure that we're not kind of recreating the wheel and making sure that we're referring to the same guidance that's been approved at the national level, we kind of just pulled directly from their stuff. And you can follow along with this with one of the handouts. I forget the actual title, but we have the ACA one and then the LA County one under the handouts today. So Jason, do you want to start off with this slide?
Yeah, sure. Courtney's right. We've been working on planning for this for probably about a month and a half, maybe a couple months now. It started with it really started, the canary in the coal mine was a lack of PPE, and that kind of process of the supply chain, thinking about how this virus affected those in China, and it really started from them. And I think AHCA, which is CAF's national organization, the American Healthcare Organization, along with the National Center for Assisted Living, have jointly come together to develop a bunch of guidance documents. We're going to go over that, but one of the main things we want you to realize when you leave this call, we have some strong recommendations that go far beyond the scope of what any community is recommending now, any county is recommending, or local public health department. We cannot afford to wait to act for a government entity to tell you to close for visitation. So we're going to cover all that stuff. We're going to give you the authority that allows this, so you don't feel like you have to go this alone. Lots of people are struggling with this. So I'm going to start with some brief overview stuff we know so far. This was done on 3/2. Obviously, a lot has happened in the last week. Things are fluid. I'll update it where I can with information that we know is more current. All right. So some of the things that we need to do to take steps now, obviously review all of the CDC guidance as it relates to clinical documentation. I think that all the states are following all the clinical guidance from CDC. I've not seen anybody any different doing anything different than that. So as you make your clinical decisions, I would use that as a basis for determining how to figure out who has a fever, what are respiratory symptoms that are consistent with COVID-19 and not just seasonal allergies or a cold. All of those things are contained within those documents. It's important for your MD or whoever is performing that function in your command center. Your medical director needs to be engaged, and that has to be a frequent occurrence, is to check on the guidance because it has changed over time. Communicate with residents and family. If you've not already do that, this won't lend itself well to a letter to family members. You certainly can prepare a letter. That's great. We have sample templates for that. My suggestion is to assign staff to call each and every family member and explain to them the situation if you already haven't. And then we're going to give you things that you need to tell them of why you're restricting visitation. And we'll go over that in a second. We're going to monitor all residents and all healthcare personnel. That means screening all healthcare personnel before they come into work every day. Support hand and respiratory hygiene as well as cough etiquette by residents, visitors, and healthcare professionals. Obviously, ensure our hands are clean, ensure we have access to recommended PPE. I'm going to go over that in a second because that's a big thing that's missing for the entire healthcare community here. And then review your facility's emergency plan. Hopefully you guys have activated your command centers and you are working within your emergency operations plan now for infectious disease or emerging infectious disease or pandemic flu, or however you have it listed in your plan. Hopefully you've got that out and you've become familiar with it. All right. So we talked about communication with residents. We're going to talk about restrictions and what that looks like, what we're recommending as a minimum. If you want to go more stringent than these, you certainly can, but these are the minimum recommendations we're going to recommend. All right. And so while that second to last bullet point says local hospital, we want to make sure that you're communicating with public health if you have a suspect COVID case. First thing, ask them, what is the local procedure for testing? Are we taking this person to the hospital? Are we taking them, is there a triage area outside the hospital? You want to take these folks, things like that. Make the call before you send somebody out. I think we're repeating stuff you guys already know, I'm hoping. Now we're going to get to the stuff that's more, that's a little newer. N95 respirators and higher are used for staff caring for patients who are on respiratory and airborne isolation only. That's the important distinguisher here. If you're a healthcare professional and you're not caring for those people, you do not need an N95 respirator mask. If you have an N95 respirator mask on in those, and it's not one of those two situations, it creates a strain on everybody else that's dealing with this. So you need to assign somebody at your building that oversees the implementation of PPE, donning and doffing, fit testing, all that stuff. One person, that should be one person's job. And and make sure that they know exactly how to, the proper procedures for fit testing and when these folks should be doing them. It should not look like an Ebola ward when you walk into your building unless everybody is on respiratory or airborne isolation. So that's what I'm saying. Let's not get crazy with these things, but understand that the N95 mask is only effective when we're doing respiratory or airborne isolation. The N95 mask is really difficult to work. I don't know if you've worn them, but you can't wear them forever. They make your face sweat. They're hard to breathe. It's not something you want to wear all the time to begin with. For patients with a cough or other respiratory symptoms, have them wear a surgical mask. If you don't have surgical masks, try to find them. Ask other providers if they have some they'd be willing to share. They're going to be really hard to come by as well. This says if you're critically low on either N95 or surgical mask and you're carefully caring for these folks, you need to submit that resource request. Hopefully you've done that already. I know a survey has gone out to ask for your kind of the status of your personal protective equipment in the building. If you've not answered that Survey Monkey, it's like 7 questions or 8 questions, really short. Please do so we can get a better picture of what the county has. But if you're short now and you're currently in that situation where you're managing respiratory or airborne isolation and you cannot and you don't have N95s, submit that resource request and state that you are currently fighting, you have respiratory or airborne isolation that you can't meet. So, and then during that process, is the Survey Monkey link in the?
Yeah, so if you again go under the agenda, there's a list of links there. The Survey Monkey, you can access it there. And then the same questionnaire is actually page 2 of one of the handouts. So this guidance is from one of the handouts today, and the questionnaire is also in that handout because that's directly from LA County. So if you've already filled out the Survey Monkey, that information's been passed on to Lori Lee Brown at LA County EMS, and she's working on getting the situational status for long-term care and reporting that up so that they can triage what supplies they do have. So if you, again, have already submitted your resource request and you're waiting to hear back, we apologize for the wait and we thank you for your understanding. It's a little crazy.
Yeah,
pretty much everywhere.
Yeah, and please follow up with us individually if you've submitted a resource request and you're currently in one of those 2 situations where you have respiratory or airborne isolation patients or residents and you cannot get surgical or N95 masks and you have already submitted a resource request. Please email me individually and let me know the situation so we can escalate it if necessary. All right, so let's move on to the next, the next slide. There we go. All right, so all visitors should be screened prior to entering any facility, including asking about fever, cough, and respiratory symptoms. Staff should be encouraged to stay home if unwell. Resources are available for just-in-time fit testing of masks. I know a lot of people have a question or think that you need some kind of special training to fit test for masks, but there's a 4-minute video on YouTube. Just go to YouTube, say fit test N95 mask. You'll find 25 videos of them. We have a video on the CAF disaster website about fit testing, but it's more in depth and it's meant to be compliant with Cal OSHA requirements. And it talks about PAPRs and a bunch of other things. So it's longer, but it's more in detail. If you're just looking at fit testing, gosh, I'm positive that there's a video that can show you how to do it in a 3 or 4 minute watch, and it'll get you right into doing the fit testing immediately. All right, so resources or review the needs for submitting program flexes. I'm going to cover that in a second as we talk about restriction for visitation, because at the moment we have not had state guidance. We're desperately asking HHS and the governor's office to implement statewide mandated visitation restrictions. But until that time, we think you need to take these steps at a minimum. So restrict entry to only individuals who need entry. And what does that mean? That means facility employees, contractors, consultants who are needed to keep the operations running and ensure the residents' needs are met. So obviously employees, that's self-evident. Contractors could be somebody like hospice or dialysis in the building, outsourced coming into the building. Consultants is up for debate. If they're providing patient care or they're needed to provide patient care, then sure. For consultants come to sell you stuff or vendors coming to sell you stuff, no, they're not allowed in the building. Sorry, go away. All right, so we'll get into each one of these bullet points. We have steps that go through it. So we're going to restrict activities and individuals with potential for exposure. We're going to actively screen all individuals entering the building. Everybody, including government officials. If you get somebody from licensing to come in to do survey, they go through the same process as anybody else. They're going from building to building. And so we want to make sure that these folks at a minimum aren't displaying symptoms. Require all individuals entering the building to wash their hands at entry, set up hand washing stations or ABHR stations, set up a process to allow remote communication for residents and others. And that's important because we don't want these folks to feel disconnected from their family members at home. All right, so what do we mean by restrict entry? Facility employees, contractors, and consultants, government officials who in their capacity require entry, immediate family or friends who need to visit for critical or time-sensitive reasons. Obviously, hospice is going to be the big one here. But for all others, these visitors should be instructed to limit their movement while they're within the facility, designated an area that the hospice folks can have their family member come. Routine social visits, though, need to be discouraged, strongly discouraged. And the rationale for this best practice should be explained. Hopefully you're doing this with the calls. You're calling to each one of the resident family members, you're speaking to somebody personally, and you're explaining to them the reason, and you're telling them this is in the best interest of the residents of your facility. I promise you guys, if this gets in the building, for every 2 people that get sick, one of them's going to die. That's a horrible proposition. So you do not want it in your building under any circumstance. All right, restrict activities and individuals with potential for exposure, including visitors when they're confirmed with a COVID case in surrounding communities. So communities like Sacramento, Yolo, Solano, Los Angeles, San Diego, all these counties that have community-based transmissions, and the counties that are directly adjacent to those counties, we suggest the following things. So that means restricting the visitors, other visitors, and tours with prospective residents or their families, any outside group activities, school groups, church groups, volunteer groups, anything like that should be restricted. Cancel any activities that take residents into the community to public places, particularly with large gatherings. We haven't really fleshed out what to do about individual passes. So when a person leaves with their family and then comes back, how do we do that? At this point, we're saying you're screening them on entry back into the building, but you can't stop the person from leaving. They're free to leave. So internal group activities should be restricted, especially if the facility has residents with respiratory symptoms. If you guys have a flu outbreak, let's not have casino night in the activity room or bingo or anything like that, guys. We're going to keep these folks socially isolated to the extent we can. Let's see here. All right, we'll move to the next one here. All right, actively try to screen all individuals. We've talked about this. Respiratory symptoms, fever, sore throat, cough, and new shortness of breath. Please note, as of March 7th, taking temperatures is not included in the CDC or CMS recommendations, and INCAL is not recommending taking temperatures, but extenuating circumstances should be taken into consideration in these cases, and individual use of gown, mask, and gloves during their visit. That just means that if you have let's say a staff member who has seasonal allergies, but they also are running a fever, even though it says, we're not taking temperatures, I'm thinking that person is probably somebody we don't want in the building. But let's say somebody has no fever and shortness of breath and a dry cough with a history of travel. We don't want those folks in the building either, even though they don't have a fever.
So it's saying don't rule it out if they don't have a fever.
Right, exactly. I listened to someone from the Center for Infectious Disease last night talk about the virus sheds before folks are symptomatic. So you could potentially have a spot where a person could only have a slight cough or a dry cough and no fever and be at their most contagious. International travel, obviously to the countries where cases have been confirmed, should rule folks out from coming into the building. But as we get large and widespread community-based transmission, this has to be really thought about whether you want to just limit it to international travel. Like I said, these are minimal recommendations. If you guys, and I know of multiple facilities that have much more stringent requirements currently in place. And anyone who's worked in another health case sitting with confirmed COVID-19 cases, we don't want them in the building. This is probably going to change. If we look at, I'm not saying that we will be Italy, but if we look at the impact that it's having on healthcare in Italy, we know that most of the healthcare providers that are dealing with COVID-19 there are also COVID-19 positive. So the folks, as they're positive, have to work because they don't have enough healthcare professionals to let the folks that are positive stay home. So if they're well enough to work, they're at work. And hopefully we don't get to that point here, but it's possible that could be where we're heading. All right. Require all individuals entering the building to wash their hands at entry. If technically possible, set up hand washing and alcohol-based hand rub stations immediately inside all entryways with signage. There's a great video on, I don't know, it's Fox 11. I can't remember the 4-letter thing. Either yesterday or this morning about a facility in Los Angeles County that had that set up, and they did a tour of it so you could see what it looks like if you're interested in what it looks like. Have each person who enters the center immediately wash their hands, obviously. Encourage them to wash their hands, obviously. And in accordance with CDC recommendations, including access to ABHR. So hopefully you guys have these spread throughout the building. Clean and disinfect frequently touched objects and surfaces following manufacturer's directions. There is some cleaning guidance that was out today, and we're going to give you a 1-page link that CAF has created that kind of filters out all of the stuff, and we're just trying to grab stuff that's applicable to skilled nursing facility and put it into one resource location so you guys don't have to search all over to go from CDC to CMS to CDPH to LA County to whatever it is. So, all right, remind people obviously not to shake hands or hug, elbow bump, whatever you want to do. Right. Set up a process to allow remote communication for residents. If you have the ability, if you have iPads, maybe FaceTime, things like that, ensure that you have emergency contact information for the family members. Develop alternate means of communicating with loved ones, video chat, those kind of things. Social media, I don't know, I'm not a social media guy, big social media guy. Maybe I'm a little old for that, but or maybe a little young for that, I don't know. But I'm not sure about the social media aspect of it, but it's possible that you could have, some Facebook video has something besides FaceTime, I don't know. Inform residents that are resident of these changes. We're going to give you a guidance document. It was included in the handouts. My suggestion is to go over this with these folks. It is imperative, though, that you explain to them how bad this disease is. I can give you a quote from the American Healthcare Association that tells you, but just for our folks in our buildings, just based on what we saw in Washington State, 50% of the people that get sick die from it. So we've got 19 or 20 fatalities already in the building in Washington, and I'm not sure that it stopped. And that was out of 40 or so positive cases. So it's bad stuff. It's really bad news. Not so bad for kids. No deaths under 10 yet that I've heard of. Generally, folks in good health are in good shape. Doesn't mean you won't get sick, but the likelihood of you passing away are slim. Develop a process for family members to communicate with the facility to get answers to their questions. And that may be just as important as having a dedicated line. I've heard a lot of providers talk about having a call-in number where people could call in once daily and you would record an update for what's going on in your facility daily, and the family members could call and just access that message, and they would get at least kind of a brief update of what your process is for that day. So all right, and so who should not enter your center? Obviously, I think we've covered this. Anyone who has symptoms of respiratory illness, traveled internationally within the last 14 days to areas where COVID-19 outbreak has been confirmed. That's a whole bunch of places, and the list keeps growing. So you might want to be even more conservative and just say, we're going to limit entrance for anybody that has respiratory illness, period, and just go from there. If COVID-19 is confirmed in your surrounding community, visitors should be restricted. What we're suggesting, even if it's not in your surrounding community, you should think about doing this. Those folks at the Life Care Center in Washington State were the first community transmission in their state. And that's because we have people that are extraordinarily susceptible to bad health outcomes from this virus. And so if it percolates out in the community, we may not know it for weeks until there is a negative health outcome, especially when in the fact that they weren't testing for it. And there's still not widespread testing of this. So be as conservative as you feel comfortable. That we've created a program flex form that I think gives you permission, and CDPH has essentially said we're going to, provided it's within reason, we're going to approve all of these requests, and we'll talk about how you do that. The form on our website that you can fill out to do that. All right. And then how do I conduct a respiratory symptom screening? Ask and observe for signs and symptoms of acute respiratory distress. Cough or sneezing, shortness of breath. Ask for symptoms of fever, sore throat, cough, shortness of breath once again. When we're talking about your staff members, this has been a real issue in Santa Clara County, is what do we do if a staff member has a cough or a runny nose or whatever? If you guys know your staff members, is this a staff member that has seasonal allergies, that has a frequent or chronic cough or runny nose? There are folks like that. That doesn't mean that they're at risk, but do they have those symptoms, and have they also traveled? Do they also have body aches or fatigue? Do they have fever? You got to use your best judgment here, but do it in conjunction with your medical director. I think it's important we make sure that we're weeding out the right folks, but not taking all of our staff away for what all of us are struggling with this, at this time of year, which is seasonal allergies. All right. So explain the rationale to the folks why you're restricting visitation. Offer them alternate ways to communicate: phone, video, chat, whatever you can do. Talk with the resident or person they want to see, and make sure they want to see the person and explain that person's request. And use your best judgments. Assess extenuating circumstances. The other thing we did not mention is we're also recommending that no children come into the facility. I love kids, and I have a kid. I think it's great to have them in the facilities, but kids are frequently poor at monitoring health, hand hygiene and cough etiquette. So we want to discourage minors from entering the building as well. And mind you, this is not guidance. It's not a ban for all visitors. We expect folks to still be able to visit. So until such times that we get a COVID case in a SNF, then I would assume that we would close for all visitation at that point. All right, should we screen new admissions? This is directly from the ACA in InCal PowerPoint earlier this month. Admission should be screened for risk factors and symptoms of respiratory infection, but testing is not recommended at this time. Fever, cough, sore throat, achiness, shortness of breath, history of exposure. Notify health department if your concern is a possible COVID case. I think we've addressed that, and hopefully everybody knows that your first stop is your local public health office. So for LA, we have multiple public health local public health offices. It depends on where you are. If you're in the city of Long Beach, you have your own local health department, which is separate than the Los Angeles County Health Department. And should we stop admissions if COVID-19 is found in our facility? Like I said, we don't know that yet because we haven't faced it, but each local health department will make that decision based on whether they think they can contain it in your building, whether they can get the person out, whether other folks are sick. There'll probably be a bunch of questions they ask before that. At this time, the conversations we've had with the state about folks that are sick. We've told them we under no circumstance want possible COVID patients in our facilities. If we have a reason to suspect possible COVID exposure from one of our residents, we want them out of that building immediately. And so we've communicated that to public health. That's our plan, is to send these folks to somewhere with negative pressure isolation. Even though the CDC has said that this is transmitted through droplets only, all of their guidance revolves around airborne precautions. So the two are not really congruent with each other. My suggestion is always defer to the most conservative thing. So, and then guidance for evaluating and reporting persons under investigation is listed there. That definitely changes all the time. So, restrict healthcare workers who have fevers or symptoms of respiratory infection. We've talked about this. You know, if you got a staff member who has no sick leave, who calls in all the time, who goes, I've got a cough, I think I need to stay home for 14 days. Well, you know, use your best judgment. You understand that. If the person appears ill, then send them home. But if the person has seasonal allergies, or they just constantly on their sick leave, you know, use your best judgment whether you send those folks home. Staff who become sick while at work should immediately self-isolate and put on a face mask, go home. Decisions. When we say face mask, what are we talking about? We're not talking the N95 mask, we're talking surgical masks, because this person is already sick. We're not trying to prevent them from getting sick, they're already sick. We're trying to prevent them from getting other folks sick. And the N95 mask won't do anything more than the surgical mask will for those droplets as they shoot out. The surgical mask is going to catch a portion of that. I don't know if you ever tried to sneeze in an N95 mask, but it's not very easy to do. Decisions about when an ill healthcare practitioner may return to work should be made in consultation with the facility's infection preventionist. It's varied. We've gotten indications all over the board. Some counties are suggesting 14 days, some much less than that. It's up to you guys to determine what that criteria is based on the guidance from local public health. I think most of them for a suspect COVID case at this point are 14 days. Sacramento County, Yolo, and Placer have changed that because now they've accepted community-based transmission and they're no longer going to be doing contact tracing or anything like that. So All right, do I need special cleaning? Yes. There's been a lot of misinformation about what are the proper cleaning and disinfecting routines for this. Does it follow things that we do for flu? The CDC has created that FAQ for infection prevention, and I believe I don't have the link here, but maybe we can go back and add the link to, there's a CDC guidance for cleaning and disinfecting as well on that same page.
And for anyone that wants to click these links, you should be able to do that because the slides are under handouts. I'm pretty sure you should be able to just control click and it should take you to the web page.
Yeah, and I know a part of the guidance, one of the documents that came out from Los Angeles today had talked about reviewing your surge plans. And so as we play the tape forward, and I don't want to be the harbinger of doom or anything like that, but I like to look at what I think are realistic outcomes. And if we look at the way this has spread through multiple countries, if we apply the same kind of growth rate within our country and the time that it will take for this to dissipate, these are not short-term procedures. These are not short-term methods. What we may be looking at is long, 6 months, a year of really refocusing how we do infection control in our buildings, especially if this is airborne and folks are shedding virus both before and after they're symptomatic, and then even with mild symptoms, they're shedding virus. It's going to be really difficult to contain this. And at this time, none of the other countries that have been impacted by this have contained it. They've been able to mitigate some of the impact, and that's what we're moving to. I think as a state, we're going to get to the point where we look at the overall risk, and we say the risk is greatest to the people in skilled nursing, the risk is greatest to the people in assisted living, the risk is greatest to the people with chronic underlying health conditions. Those are the people that we're going to try to protect with these procedures. And for other folks, we're going to accept that we're going to get sick. And that when we do get sick, we stay out of work, so we reduce the amount of people that get sick. But that's where Sacramento County has moved to, that's where Yolo County has moved to, and that's where Placer County has moved to. We fully anticipate the remainder of the state as this expands to follow suit. So there have been no indications of positive outcomes or indications of countries being able to control the spread of this. And so far, we've been unsuccessful at doing that. So we need to look at protecting those that are most vulnerable, and that's the folks that are in your buildings. Make no mistake, these are the folks that are most at risk. So hopefully I didn't give you doom and gloom. I will say that with that being said, you guys know how to protect folks from flu, but it has to be a focus. This has to be your number one focus for a long period of time, because once it gets in, there's not going to be a whole lot you can do to protect people. But if you get a suspect COVID case, obviously call local public health and let's get these folks out of that building as soon as possible. Get them into a negative pressure isolation room. And things like that. If you guys have, I know there's not many, but if you have a negative pressure isolation room, please, obviously you'd use that instead, but I don't think there's many of those folks. All right, and then roommates of persons who test positive. None of us, well, most of us do not have private rooms or semi-private at a minimum. Asymptomatic roommates have already been exposed. So you're either going to move these folks to a single room if you have them, or they're going to stay in place and isolate together. Because if you move them out across, you're spreading it outside of that room. So like I said, I know that CDC has said this is droplet transmissions, but their guidance for healthcare workers are all related about airborne isolation. So take it for what it's worth, but I don't know that it's only droplets that are causing this thing to spread at the rate it's spreading. So I would be cautious about that. But those N95 masks, only when you're dealing with those residents, that's it.
Okay, so it looks like we have some questions. So I'm just going to put this up here while we go through the questions. So thank you, everyone. Just bear with us here. Let me figure out how to pull this up. So it looks like we have one question from Grace. Any suggestions for ICFs whose clients go out to schools and day programs?
Well, Grace, that's a great point. I think generally I don't know what kind of underlying health conditions your clients have, but traditionally the younger folks have performed very well with this virus. That's the early indications, and it depends on the underlying health conditions that may cause you to pause or hold off on those group outings. But as it relates to schools, my only indication is what they're doing for the pediatric subacutes. The kids that are in the subacute programs that are peds, they are still going to school, even though the remainder of the facility is restricting outings for residents and things like that.
And we're actually seeing some school districts close up here in Northern California, so that issue might kind of resolve itself in a few weeks.
Yeah, and Grace, I'm not sure who you advocate with at the schools that these folks go to, but I mean, I would approach the subject and ask them, is there any plan to do online or distance education if our clients have underlying health conditions that could put them at risk of being in groups of people? I would at least ask that question. So Grace, you certainly can do the temperature checks at entry of staff. We're just saying that the CDC had removed that recommendation, but certainly in your tools, that's another tool. It's not, they're saying it's not 100% appropriate, but it's just one more extra layer I think you can add. I don't know that you need to remove it if they're not recommending.
Okay, we had one other person say, can you please email the slides? So I can definitely do that. And then I just wanted to point out under the handout section, which should still be live, you can find the slides, today's evaluation, and then the guidance documents that we reviewed. And we're gonna stay on the line here in case anyone has any further questions.
Let's see if can we find Rich?
Yes, can you hear me?
Hey, there he is.
Rich, you were
was here. Sorry, getting on was difficult. What I would like to say that people should begin to develop a plan, because it looks like the area school districts may close all of these schools. And if that's the case, the parents are usually the caregivers. It's going to be very difficult to staff, in my opinion.
Yeah, and as you as providers, obviously we normally would say, oh, hey, let's set up an area and have our staff bring their kids and do a daycare activity day, but definitely don't do that. So Rich is right. You guys, we're all struggling with this. Every industry, not just ours, even CAF. We have folks personally impacted by this. It's going to hit us all. We're all going to have to really consider our time off plans or procedures for our staff. We're going to have to rethink PTO. We're going to have to really come up with those things. We haven't got to that point yet. I think we're close. I think it's moving that direction. Like I said, I'm not getting any indication from other countries that are struggling with this, or even other communities in the United States, of them being able to contain it. So I think we got to worry about just trying to slow the tide.
And I actually I set up a poll while I have everyone still
Oh, yes.
mostly on, but we're just kind of curious if you have submitted a resource request. Let me just make sure. Okay, yeah, so it's live now. So if you're still online and you want to kind of just share with us, so it looks like about 70% of the folks online have submitted resource requests. So that's good to know. Let's see, those responses are still rolling in.
All right. Well, I'm glad you guys are submitting the resource requests. I know you submit them and you might get denied, but at least we can track who's getting them. So.
Yeah.
All right, Rich, did you have anything else from the DRC meetings that you've had a chance to attend before they started canceling them all?
Yes, don't forget sign in and out sheets. From what I hear, health department's asking for those types of things. When you're doing deep cleaning, use an approved product and keep a log of the deep cleaning, what time, things of this nature. Set up a schedule, in other words, because it's above and beyond what we're doing now. And then last but not least,
Rich disappeared. It's like he's slowly walking away from the microphone or something. So.
But from what I got, just reinforcing that you need sign-in sheets from your staff if you're going to be doing any exercises, because that's the main way that surveyors verify that you actually trained your staff on your emergency operations plan, and that is an e-tag by itself. So that's a really great.
Can you guys still hear me?
Oh, we can hear you now.
You're back. Okay, great. So Rich, did we hear you correctly there? So the sign-in sheets, those are for staff in the exercises?
Yeah, all right. The sign-in sheets for anybody coming in and out of the building is what I was referring to. Then,
yes.
Sorry, our phones just went dead. I'm on another one. In terms of deep cleaning, use an approved product, develop a log so that because the health department, from what I've heard, have already been looking for those types of things. And then it's worthwhile to purchase an infrared laser thermometer at Amazon for about $60, $59 and change. And what you do is, in the event that you want to screen everybody, they come in, you just hit their forehead with this thing. It's like a turkey. It's done.
Yeah, and there's a number of facilities. Like I said, I don't want to call facilities out by name, but there's one facility that was on the news this morning that has an extremely stringent screening process when they come into the building, not only for visitors but for staff and government agencies. Los Angeles Jewish Home is doing the same thing. They were on the news as well. All kinds of larger facilities are doing this. Our recommendation is at a minimum do what ACA recommends, what we've gone over here. This document is available on the CAF website on caf.org/resources/coronavirus. Is that what it is? Yeah.
And that link is on today's agenda as well.
Yeah, and what's important is we update that daily. There is what's called a Program Flex 5000A form. If you guys are gonna take these steps to restrict visitation in your buildings, there's a form that you submit to CDPH. The email address is on it. You just email it directly to them. We have filled out most of the form to have the language for why you're requesting to limit visitation. That's already done for you. All you have to do is fill out your individual community's name, your administrator's name, your phone number, today's date, that kind of thing. But the law, the regulation that needs to be flexed is in there, and the language that describes the ability to flex is in there as well. So you don't have to create that. We've already done that for you. It's on the website as well.
And that's on the caf.org webpage.
Yeah, anybody can download it though. It's member, non-member, doesn't matter. So.
Okay, so we had a few more comments in the questions panel. So one provider said that LA County Public Health is visiting the skilled nursing facilities in LA.
That's correct. Yeah.
And then another provider said that they've activated their external triage protocols. So that's awesome.
Yeah, that's Susan Leach is from the LA Jewish Home. So we know LA Jewish Home is on there. We asked we've asked maybe to send some media there because it's a great representative of the skilled nursing community and long-term care at large. But yeah, and if you guys, I feel very strongly about this. If you can't tell, these folks in Seattle were the front line. They had no warning that this was coming into their building. You guys have some warning, so let's get prepared. You know, take these steps very seriously. Think about this as a long-term commitment. We've got to, how are we going to accomplish this? Not just today or Friday, but April 15th, June 30th, August 27th. Those are all days in the future. If we think about when this started in China, we hope we're better at managing this than China, but I'm not certain it has anything to do with our capability to manage it. It may be outside of our scope to be able to slow things down. So we have to understand that this could potentially go on for months. When we talk about planning and staffing and all that stuff has to be considered. So I know you guys are worried, sick to death. I think we can get through this as an industry, but I think we all have to be united and we have to help each other. If you have extra masks and somebody's got a COVID case, man, send them those masks. This just-in-time thing where we only order supplies, you know, when we need them, has made it really difficult for us to get stuff when it's a natural disaster. Hopefully the government's heard that loud and clear and we could start stockpiling things like we used to, but until that time, we're going to have to rely on each other to help each other out. So.
And I just want to point out that even if you are submitting resource requests and not getting any supplies back, all of that data is still being pushed up to the state and the federal level, and they're looking at that because they do have like national stockpiles. Yeah. And so again, kind of going back to the idea of the squeaky wheel, I know it's urgent, but please still keep sending those in and keeping us informed of what your situation looks like. So. So we've still got the questions panel open for a couple more minutes in case anyone has any more thoughts, and then I think we're going to wrap it up for today. I will send out the handouts in an email and the evaluation as well, and we will be available to you if you have any other questions afterwards. Okay, well, thank you so much, Rich, for joining us. Thanks for making it work with your phone dying and attending those DRC meetings for us. We always hear really great things from the providers about.
And please, everybody in Los Angeles County and everybody in the state of California know that every single employee at CAF is actively working the response for the COVID-19 virus. We stand ready to assist you and we will advocate on your behalf if there are needs that you don't have met. As you go through this, please don't hesitate to email us. We should be, we're happy to assist where we can.
So we had a comment from one provider. Where can I find the letter? From
HCA, the letter, sample letter for a resident. So if you go to the caf.org/resources/coronavirus, if you look there, it should have the first section says resources and it has links to different websites. The one that says American Healthcare Association, if you click that, scroll to the bottom, there's sample letters for family members, sample letters for staff, sample letters for all these other folks. So. And these are not our recommendations for just SNFs. These are our recommendations for all assisted living, any long-term care. This should apply to everybody. So if you have a CCRC, we think you should apply this to both the AL side and the SNF side. All right, thank you so much, guys. Thanks for hanging out. Emails with any individual issues, and we'll be happy to help.
Yes, our next webinar is going to be on May 13th, so we will talk to you all then. If you have any ideas for topics, we're always open to taking your feedback, and hopefully we will have something besides COVID to talk about next time we're all together. So thank you so much, and we're going to wrap it up today. Have a great day.
Thank you.
Bye, Rich.